Yeah, same link.
Okay. Away. Okay. So after Medicaid expansion got passed, we saw that there was still a need for people to get assisted in getting connected with Medicaid. So we started our enrollment initiative, which is Take Care Utah. And this provided direct service to people applying for Medicaid. And we have about 20 health access assisters whose main role in our organization is help people sign up for Medicaid and marketplace health insurance. We already serve a variety of populations, including but not limited to those that are justice involved, those experiencing homelessness, those with mixed status, and individuals with disabilities. A little bit more is after Take Care Utah was established, we decided that we wanted to expand a little bit. So we took on another grant for the Linkage Project. And in the Linkage Project, which I'll go over at the end, we help adults with disabilities get connected to different support programs and resources across the state. So I'll let Heather go off about Medicaid a little bit. You want it?
I feel like I feel better about the situation.
Okay. Naomi just makes me do it, so.
Well, and they could hear me probably better if
Okay.
it's recording, so. So I'm Heather and I'm a health access assister coordinator. So I help people with the process of Medicaid and ACA. 60% experience healthcare affordability burdens and 80% are worried about affording healthcare. If they did a study a while ago that if you give a family a Medicaid application, chances are they're not going to be able to finish it, complete it, get all the verifications. I believe it was like 30% were able to get it compared to.
With a health access assister, it increased that percentage up to 70% of actually getting that application submitted.
And approved.
Yeah. It's the arrows.
Gotcha. So we help Medicaid, ACA, Marketplace, Obamacare, CHIP, and Coverage to Care. With CHIP, they do have a program now where for undocumented children, they can get health insurance. And Coverage to Care, we can help them find a doctor, whatever they need. And a lot of times we will link them with our linkage coordinators if they do have a qualifying disability. So this is how we help. We will screen each client, and sadly it is before taxes, whether or not they fall in the household range, who's applying and what's the legal status. We do a paper application. Most of us do a paper application, but if you do an online application, we can still help you where you can sign our consents, so therefore we can access your case online. DWS will ask for verification such as proof of income, where you're working, pay stubs, all that good stuff. And then we will go ahead and submit the application. We are helping and advocating for you, and we will also follow up with the process. If we don't get the verifications in, we will resubmit a new application, try again. So we just don't give up on you once it's one and done. Arrows. So who is eligible for Medicaid? So you have to be a Utah resident, age 19 through 64, a U.S. citizen or legal resident, except for the CHIP children. And you have to meet the income requirements, which vary by household size and what type of Medicaid you're looking at. Medicaid and CHIP are open for enrollment all year round, so there's no special enrollment. However, there is, if you have like a select health plan and you want to get the University of Utah health plan, you have to do that between mid-May and mid-June. But if you get the plan, if you apply for Medicaid, you have, is it 90 days, I think?
30 days to pick a plan.
30 days to pick a plan. And these are some of our programs. We'll talk about those in the next slide.
So if they, I'm sorry, if they want the home clinic, then is that what you're saying? If they want to attend the home clinic, it has to be between.
Healthy You. So,
Oh, okay.
there's, I think, 4 different
Yeah.
vendors, not including Optum, which is a mental health provider specifically,
Right.
that, you can pick from whenever you get approved for Medicaid. So depending on, there's a health program representative line that you can call. And they, if you already have doctors established, they can help you figure out what plan is going to be, what your doctors are going to be in network with. There's Select Health, Molina, Healthy You,
And Healthy Choice.
and Healthy Choice.
Okay.
Um,
So if they're, because I know like when I joined the home clinic, I had to talk to their person, Heather, I think was her name, and she said she was gonna switch our Medicaid so that we could attend the home clinic. So I kind of had the impression that they had their own. Is that the case or am I?
so the
confused?
home clinic
It's
is just
just
through the
Healthy
U,
You.
so it's
Okay.
Healthy You.
Okay,
You probably were just within that time period, but it is mid-May to mid-June.
Okay.
You have the option to switch from Healthy You to Select Health, etc.
so whichever kind.
Mhm.
Okay, that's good to know.
Good question on the household income, so since my daughter's 27, is it my income? or
No,
her income?
so now that you're, as long as you don't claim her on your taxes, yeah, it will be just her income.
Okay.
And that's something we fall into a lot, like Medicaid is a really good insurance for some of our young adults. And so they can apply for Medicaid at 18, 19, as long as you don't claim them on their taxes.
Okay.
Unless representative payee, because if a representative payee, that's completely different, and then they can, they do have to look at that kind of income if it's a rep payee, correct?
If they're on Social Security,
Yeah, and that kind of stuff, because rep payee is, if someone is over age 19, but
Mhm.
they're, have a rep payee, they can't sign those kind of legal documents, they can't
Right.
apply for it, so the rep
Right.
payee, they'll have to look at the rep payee's information at that point, though.
They didn't with us.
no.
I've
you
never
don't
heard of
have
that.
to.
Okay, so
Like
it's,
my
you're saying
mom's-
it's just off, but it doesn't matter with their rep, you're saying when they apply, it goes strictly off of just the
Them.
Yep.
individual. Okay,
Yes.
okay.
That's what it does with my Jessica too, even though, yeah, I'm the rep payee and we do have. I lost my train of thought, never mind.
What's a rep payee? Sorry.
Representative payees, if you're on Social Security, they're the ones that are in charge of managing your funds.
Okay, so
Yeah.
like guardianship.
Yeah,
It's a little
Okay.
less than
It's-
guardianship, it's
yeah,
like a
it's just
step
financial.
before.
Okay,
Yeah.
cool.
But so, well, the reason why I'm asking all those questions is because like when you bring in like Medicaid and different benefits, like then there is other things like they will look at income if someone is living with someone.
Yeah.
It's
Based
for
off of
Social
that.
Security.
Yeah, I was gonna say they
It's
do
for
offer
Social
social security and
Security.
they do offer, but you're just saying strictly if someone's just applying for their Medicaid or. the
For
CHIP.
Medicaid only,
Okay,
yeah.
just making sure that you're, okay, thank you.
It's too complicated, we have too many questions.
Yes.
the whole time.
Perfect. So CHIP is the Children's Health Insurance, and then the typical Medicaid, and the Utah's premier partnership for health insurance. I'm not really, I've never applied anyone for that, so I've never even used it. An adult expansion, targeted adult Medicaid, or spin down, which is the Medicaid work initiative. So if you make too much, then you can spin down, or you can actually just get an ACA plan. And sometimes that's might be a better option instead of losing all your money towards insurance. So it just takes a portion of your Social Security. Because I have found out while doing ACA plans that it's a better deal to do a marketplace application rather than spend down. But that's just personal, what I've noticed.
Wonder if we should look into that for.
Do you have a spend down?
No, the spend
Yes.
downs come into, spend downs, you're talking about when they have the Medicaid, they have the dual coverage and spend downs, you have to pay a spend down to keep your Medicaid. If they don't pay that spend down,
Right.
they won't be able to keep that.
Right, but
Medicaid.
if they have Medicare, then yes, that's true.
Yes,
But if they
they're-
just
Oh,
have,
okay.
if they just have Social
That's when it'd be
Security,
total.
Okay,
Gotcha,
gotcha.
that's
Yeah.
where it's like, okay,
Yeah.
I got you, thank you.
of
Okay,
course.
Too many things.
There's so many barriers and
Rules.
there's so many rules and
Yes,
so many,
yes.
Like in this situation, then this applies, and in this
Yeah.
situation, this applies.
You're just talking about if they just have the spend down.
yes.
Gotcha.
Oh, I always hit the enter button. So this is the income guidelines for plan for the different plans offered. So for example, like the federal poverty level here for Medicaid, I'm sorry, for a pregnant woman, this is the household and she's a household size of 1. So this is how much she can make a month. A household size of 2. So if she was married to her partner, this is how much they could make.
Real quick, one thing that I do want to point out, oh, I just stepped on my thing. As far as the spend down goes, you have regular age blind and disabled Medicaid, which is for people 100% below the federal poverty line and also have a qualifying disability. If you have a qualifying disability, but you're over that 100% federal poverty level, but under 250% federal poverty level, you can then, that's what qualifies you for a spend down. And so, depending on, it's not this number and it's not this number, it's really complicated how they determine your spend down, but whatever over that number that they decide is how much your spend down ends up being. So it can be anything from, the base is usually about 1575 is what I've noticed for spend downs. So if you make 1580, then your spend down is only gonna be $5. But if you make 1800, then your spend down is gonna be $300.
So they just take whatever is from the amount, they're just saying that's the leftover from that is how much you're gonna
Yeah.
owe for your spend down.
Here's a prettier version of that. So this is the 100% federal poverty. These guys will qualify for adult expansion Medicaid as long as they make below this.
And that's annual, where the last one
Yep.
was monthly.
Yep, this is annual. And the 200, so this one right here. So if you make, let's say 2200, then you would have to get ACA insurance and then your children would qualify for CHIP. Does that make sense? Okay. Oh, I always hit the enter button. So again, this is more about the adult expansion Medicaid. Who qualifies? So 19 through 64. After that, you can get age blind disabled Medicaid, but this is just for adult expansion. You have to meet the requirements and you have to be a US citizen or a legal resident. These are some basic adult expansion benefits. So you can go to the doctor, hospital, emergency services, get your prescription, get your MRIs, your x-rays, of course, behavioral health, family planning services, maternity care, home health services, preventative and wellness services, as well as any chronic disease and so forth. Oh, again, enter. So this is the age blind and disabled Medicaid. So who qualifies? If you're 65 and older, or you're blind, or you're disabled. If someone has already been determined disabled by Social Security, they automatically qualify for a disability Medicaid as long as they fall within the income limits. If not, the state Medicaid and Medical Review Board will make a decision, and the process can take at least 90 days. So usually what I have done, and I don't know if this is like the right thing, but I'll apply them for Medicaid expansion just because they need to get to the doctor, they need to get all their medical needs met. Expansion, depending on the needed verifications, can take not very,
Like 2 weeks.
3 weeks. And then I will apply for that disability Medicaid after that.
Okay.
That way they can get to the doctor, they can do everything they need to do. The asset limit is $2,000, so you're only able to have in your bank account the 2,000 unless it's an able account, correct, Sadia?
Able's only for Social Security, not for Medicaid.
What she
Oh,
said.
I didn't know that.
Yeah, I'm pretty sure. Do you know
I was
any
gonna say,
different?
I'm working with an able account right now and, I need to go double check that because
Yeah.
I didn't realize that for the insurance part of it. Now for the income, yeah, it won't, if you have it in the able account, you're fine, but I need to check that other part.
That would be something we should look
Mhm.
into.
Let me go look up able real quick, 1 second. Well, I'll look it up while you guys continue, what I mean.
So for those who qualify for Social Security, for
Mhm.
SSI,
SSI, yep.
then they get Medicaid and they get, and, cause I mean, a lot of these, like my daughter, I claim her as a dependent,
Mhm.
but she still gets Social Security, she still gets Medicaid, she still, you know what I mean?
Mhm.
Our, like, they don't look at our income
Because she's
at all,
Over the
older.
age of 19.
because she's 32.
Yeah.
So, okay, gotcha,
For the Social Security, she gets SSI.
yeah,
They probably look at in-kind maintenance and support.
yes,
Okay,
yeah, so like I have to report
yeah,
how much
If
she
you
pays
did-
us in rent, you know,
Yeah.
and that kind of stuff, and how much her living expenses are and all of that.
Yeah, because if you didn't send that in, then her check would be different than what it is.
Yes,
Yes, because
Yep.
they have all the earnings.
Uh-huh.
okay, gotcha.
So this is what Zadia was talking
oh, I
about,
forgot I had a slide about it.
because you're awesome.
Mhm.
Zadia put this wonderful slide together, so. Medicaid Work Initiative, that is a Medicaid program for persons who meet the Social Security criteria for disability and have earned income, so this way they are able to work.
I got that answer for you guys on the ABLE.
Yeah,
Through the ABLE Utah, you can open and maintain a stable account while keeping your federal and state benefits, SSI, SSDI, Medicaid,
and
SNAP,
Oh.
TANF.
okay,
If you receive supplemental security income, there is 100,000 limit
Mhm.
before the funds start counting against your 2,000 asset. So if you get the 100,000 in an account, then they'll be like, okay, now there's some missing. But
yeah,
as long as the money is withdrawn and is used for eligible expenses, it will never count towards that limit.
awesome.
That's
I
good to
didn't
know.
that For Medicaid.
That is good to know, because that's one that you can actually spend on housing.
I automatically
Yeah.
assumed it, because it's an able account, so I just automatically assumed that. I didn't even think to look at
Right.
that until you guys said something, so. yeah.
So during COVID, they had emergency COVID, and so you did not lose your Medicaid. And then in March of 23, they started sending out letters and kicking people off Medicaid. We're not running into this as much right now. However, if with Marketplace, you have to lose qualifying, like for special enrollment, there has to be a qualifying
Life
event, thank you, life event, and losing your Medicaid, even if you lost it back in March of 23, you can still qualify for a special enrollment period now.
That's good.
So that's like excellent. Like I'm helping a person right now who lost their Medicaid in November of last year, and they still qualify for ACA. But if it was just another regular insurance, like a job-based insurance plan, you have the 60 days to get a marketplace plan. Any questions? You guys have been really good about asking questions throughout.
I'm glad we're recording this too. Then we can go back and, now what did they say about that?
Okay, so I'm going to talk a little bit about SSI and SSDI, mainly about SSI. So what exactly is the difference? So SSI provides basic financial assistance to older adults and individuals that have disabilities with little to no income or resources. Like we mentioned before, you automatically qualify for Medicaid when you get approved for Social Security. The max benefit right now for SSI is $943 a month. Social Security disability income, then SSDI, helps financially support individuals with a disability that also have qualifying work history credits of their own or a family member. Disabled adult children can draw SSDI from a parent's work history if the parent is currently receiving SSA benefits or is deceased. You automatically qualify for Medicare 1 year after qualifying for Social Security disability. And the max benefit per month for SSDI is $3,822 a month, which is a big difference.
They changed it to 1 year for Medicare now instead of the 2. That's
Mhm.
nice. That's way nice.
Also, on that note, if you've had Medicaid and Medicare, there are some Medicare plans that will help pay for additional food.
Oh yeah, you can get healthy food cards and stuff with that. You
Yeah.
can, even like Molina, you can get like free cell phone plans with the Molina Medicaid card.
Yeah, there's a lot that'll even just like pop up on Facebook saying you have EBT, Medicaid, they'll say tablets, phones,
Yeah.
internet, but they actually, I heard they were going away with the internet.
With the EBB program, yeah.
They
Yeah.
took that away this year.
Yeah.
Okay.
Okay, so I wish I could see what this says. Step 1. Oh, set a protective filing date. So a protective filing date is basically you're going and you're telling Social Security that you're going to apply. This date is used to determine when an individual can start receiving benefits. And so in most cases, there will be a retroactive payment for the months between the protective filing date and the date the application was approved. You have 60 days to completely send in all the paperwork after you set the protective filing date. The easiest way to do this, you can go into the Social Security website, start an application online, and it'll set a protective filing date on there. It'll let them know that you're ready to apply, and then you can continue your application. It'll give you a re-entry number. And after you get that re-entry number, you can use it to log back in to your application. I'm gonna go over this a little bit, but personally, I do a paper application and I do the online application. The online application, it seems a little more abbreviated. You can't really get in all the information that you can. And then filling out like the disability report, it's a lot easier to get those in through physical mail and have them scan those in. Whereas sometimes they won't have the complete application whenever you just do it online. It's really finicky, so I always do both.
Well, most likely, if you only submit an online application, you will most likely be denied anyways, because you can't get all the information in, and it
Mhm.
does say in any
Especially
of the
for-
trainings.
Are for those here.
Yeah, you need to actually do paper and online.
Yep.
It says it in
Yeah.
a lot of stuff. We want both.
Yeah.
It's just, yeah.
Do they
it's
tie
better.
together somehow? How? Do they know that you're sending?
They open a case.
Yeah, they'll
Okay,
open a
put
case.
the paper and online together.
Yeah. So the next step after you set the protective filing date is to complete the applications. There's 2 main application forms. There's the SSA 8000 or 8001. Sometimes they request 8001. It drives me crazy. It's all the same questions. It just looks a little different. Or for the SSDI, they have the SSA 16, and that's your initial application. For both SSA and SSDI, SDI, SSI, and SSDI applications, you would be filling out an adult disability report. This is the longest and most time consuming and probably the most important. Your adult disability report will go over your medical conditions, your symptoms, treatment, what medical providers you're seeing for them, what medications you're taking. And this is really important to fill out because they will use these doctors that you put on there. It's basically your references list,
Yeah.
and they'll call them.
Okay.
We've also had people call us for our
Yeah.
academic record.
So there's
Not
another
academic,
section
but our-
on,
Our.
Yeah.
Yeah, all of our
mhm,
life skills training, all the classes, the coaching, they'll call and get records on that and how, because we record our observations on, when their mental health gets in the way or when,
Yeah.
and I think that's really
Mhm.
important to have those records, especially for our clients, because a lot of times a one-on-one interview with our client will not reveal their disability at all,
mhm,
but those records do.
yep. And they don't ask that you send in medical records whenever you do send in the application, but I found it helpful if you have some, like a one with like a list of diagnoses from your doctors with the RX numbers is really good to send in. If you have like a letter from your psychiatrist or something, those are really good to send in with your application as well. The other form that is necessary is the 827 form. This is the authorization to disclose information to Social Security. This form is just letting them call the doctors that you put on that paper.
The 827.
Mhm.
Yeah, if they don't get it, they won't get your information.
And this is another one where you digitally sign it on the online application, but they never receive it. You have to send in a physical copy of this one.
Yeah,
It's a pain in my
I was gonna
butt.
say in the case training, I did a case training to become a case manager.
Mhm.
It says in there, if they do not get this form, you will automatically be denied because they
Mhm.
can't get any of the information
Yep.
from the doctors. Yeah.
And then another optional form you have is the SSA 1696. I have all my participants sign this. This lets me call in to Social Security. And then we have the 3288, which is just a regular release of information, where if you wanted your mom to be able to call and check on your benefits, well, I guess if you wanted to call for your daughter,
Right.
because you are the mom.
Yeah.
But yeah, so all this can be done through the My Social Security portal or on paper and mailed in. Like I said, some forms like 827 have to be mailed in.
And I've noticed that I have to have those forms in, even though I'm her legal guardian,
Mhm.
like, they look for that form first. Yeah, so.
Okay.
Unless I just got somebody weird, which is also possible.
So Social Security determines non-medical eligibility. This is just things like citizenship, employment history, and asset evaluation, making sure that you're not working 40 hours and getting paid $30 an hour. And then the asset evaluation is just that $2,000 limit. Then this is the fun part. This is where you take 9 months to wait. The average is about 5 months, but when I was talking to one of the caseworkers at Social Security last week, they told me that the average right now is about 9 months to get through the disability determination services.
And that's
So-
why you want that date. You
That
want to
protective
put that
filing date.
protected date in there.
Yep.
That makes a lot of sense.
And then if you
My
have to
husband says it makes
appeal,
sense.
it still goes back to that date.
Goes
doesn't
back
it?
to the protective filing date, yep.
Okay.
So DDS will assign a disability adjudicator to their case. Their role is to determine if the applying individual meets the disability standards for SSI. They are the ones that call the doctors and get the medical records. All medical providers provided in the application will be contacted by DDS to confirm the medical history and disability status. Things they look for to see whether or not you can engage in substantial gainful activity. I have a thesaurus, I guess, on the other page. They see, is your condition severe? Do you meet a condition? Does your condition meet a disability listing? They have an index of qualifying disabilities and what symptoms you have to have for those conditions. it's pages and pages and pages long, but that's a good thing because a lot of different disabilities can be approved. They see if you can work a full-time position and what daily activities does your condition limit.
Does it specifically say full-time, or is that the question that says, can you work?
It says, can you work? Yeah,
Yeah.
yeah,
Okay, and that's something that a lot of people, like, especially our clients, they take it really literally.
yeah,
And then they're like, yes, I can work, I work 10 hours a week, but I can work.
yeah.
I'd like to, but can I get a job?
Exactly, and so that's a sticky one, that's why it's
Yeah.
important to get help, because if you're gonna read it literally like that, you're gonna put in the wrong answer.
Yes.
So do you say no?
Well, no, you
You
have
say
to say
no.
yes. No, you have to say yes. You have to be true on that application. You have to
But-
put yes.
Is it asking,
So it's asking, not full-time position, but what they're asking is if you can, engage in substantial gainful activity. Let me see if I have. So substantial gainful activity is used to describe a level of work activity and earnings. And if your work is substantial, it involves doing significant physical or mental activities or a combination of both. And to be gainful work activity, work is performed for pay or profit. That is about $1,550 a month.
Okay.
And if you meet that substantial gainful activity,
So if you can't earn more than that, then you say no on that question?
Yeah.
Okay.
okay,
let's go back. Yeah. And so after DDS, they send it back to Social Security. If denied, Social Security will contact the client by mail instead of phone. I wish they would call, explaining their decision. And all applicants have the option to appeal a decision within 60 days of receiving a notice. If Social Security is approved, then they will calculate your benefit amount and then notify you by mail. Most Social Security payments are done through direct deposit, but can be done with paper checks in some situations. It's not quite a hard rule, but here last year they did really push for direct deposits. But they do paper checks in some options. So kind of how they figure out how your income or how they calculate how much your benefit's gonna be. It's your total income minus the income that they don't count is your countable income. And then the SSI benefit rate, which is the 943 minus your countable income, is how much you get for Social Security benefits. So some income that they don't count the first $20 of income received in a month. So if you get 943 a month, they only count 923. And then they also don't count the first $65 of earnings, as well as 1/2 earnings over $65 received in a month. So if you make $165 that month, they will take off that 65 and then divide it in half. And so your earned income or your countable income is only $50 then, instead of 165. They also don't count things like SNAP or grants, scholarships, fellowships, gifts for tuition. And the thing that it says underneath there is they don't count loans or things that you have to repay to people either. So here's a little bit of an example. If your gross wages are $317 a month, the first 20 they don't count, plus the 65 that they don't count, is $232. Instead of using that 232, they put it in half, and $116 is your countable income. Subtract that from the SSI federal benefit rate, meaning you'd get $827 a month in SSI. So I went over substantial gainful activity, but another thing that can affect your Social Security benefits is in-kind support and maintenance. This is any food, shelter, or both that somebody else provides for you. Social Security counts in-kind support and maintenance as income when they figure the amount of your SSI. For example, if someone helps pay your rent, food, or mortgages or utilities, they will reduce the amount of your SSI. I wish I could read what that says under there, but one thing to keep in mind is it's up to $334 is how much they can reduce your benefits by if you're getting in-kind support and maintenance.
How does that work with your daughter?
So we charge her rent
Mhm.
Okay.
and she pays for her own food and she pays for her own clothes and all of that stuff. And with the economy the way it is, that pretty much uses up her money.
Yeah, so then they don't deduct because you're not paying. for
Correct.
it. Okay.
So if you get a denial, the first step that you can do is just a simple reconsideration. It's just one form, or you can do it online. I always do it in person, or by calling them or mailing it in. The easiest way is to file a request for reconsideration on a disability or non-medical disability determination is online on their appeal a decisions page. If the reconsideration is unfavorable, then you will have a hearing. If you disagree with the reconsideration determination, you or your representative may request a hearing before a judge by writing or by completing a form, request for hearing by administrative law judge. You can do that online or by mail. The hearing process is very similar to all types of appeals. If your request for your hearing is about whether you have a qualifying disability, the judge will focus on your medical conditions and make a decision based on the evidence in your case file. The judge may also call witnesses to testify. For example, they may call a medical or vocational expert, and you guys are considered vocational experts. Yep. If the judge does not give you a favorable decision, there's one last thing that you can try, which is an appeals counsel. If you disagree with the judge's decision or dismissal of the hearing request, you or your representative may request that the appeals counsel review that action. The notice you receive will tell you how to appeal the judge's decision and order. If the appeals counsel cancels your request for review, it will either decide your case or return it to the judge for further action, which could include another hearing and a new decision. And then you just kind of go in a circle until you get approved.
And hire a lawyer, is that what I'm hearing?
Yeah, so usually if the reconsideration doesn't go through, I usually just connect my clients with the Disability Law Center and they help out with the rest of it.
Yeah.
They're so great.
They are. Do we have any Social Security questions?
Only like, can I make an appointment to come and talk through a specific situation with you?
Yes.
You guys know so much. I'm like,
Yeah.
Right? Isn't it great?
Also, one thing I forgot to mention about Medicaid, disability Medicaid, if you apply for, let's say, you have schizophrenia, you cannot, and you're denied Medicaid for that disability, you cannot reapply for disability Medicaid with that same diagnosis. You have to have a new diagnosis for disability Medicaid. But if you get Social
Okay.
Security, then they've already done all that, so it doesn't matter.
Right.
So if you're denied disability, then your next step would be to do Social Security if you think you qualify.
And
We tell people to do Social Security first.
yeah, go through that DDS service. I mean, it takes longer, but then you automatically
And
get
everything
approved.
else is so much easier
Yeah.
after that.
Yep. Another thing about ABD, Age Blind and Disabled Medicaid, is that it includes dental benefits through the U of U School of Dentistry. Only them, but at least it's some type of benefit.
Yeah.
The last thing that I was going to talk to you guys about today is just our own special program. My pants are always unzipped today. That's like the third time today.
That's gonna be on the recording, that's amazing.
That is gonna be. I forgot.
That's okay. That's awesome.
But the last thing I wanted to talk to you about is our program, the Linkage Coordinator Program, which is where you can come and make an appointment with me. Kind of what we do is we use a screening tool that identifies participants' unmet needs. We provide the client with some health education on the importance of healthcare, specifically preventative healthcare and healthy eating and physical activity. We also assist them with setting healthy goals if they do have one. And then we link the participants with the needed providers and resources. As you guys probably know, I could probably skip this, but individuals with disabilities are 3 times more likely to have heart disease, diabetes, stroke, or cancer. They're more likely to smoke, be physically obese, or be physically inactive, and are more likely to be diagnosed with mental health issues like depression. They're also less likely to receive mammograms than the previous not just mammograms. That seems very oddly specific. I meant preventative health care, such as mammograms or colonoscopies in the previous 2 years. And just in general have less adequate access to healthcare. And so that is our job, is to help them get reliable access to that healthcare and other resources that can help them stay healthy and learn more about their life and how to navigate the difficult systems. For the project, 18 years or older, live in Utah, have a disability. We don't require proof, no medical documentation or anything. The screening tool is pretty simple. It has some knowledge check questions that are like this. It asks, let's talk about visiting your doctor. Can you tell me some reasons why it's important to see your doctor for regular checkups? And then we follow that with health education. The screening tool also asks things. It goes over preventative health, mental health. It also goes over social determinants of health things like if your heater doesn't work, if you're dealing with pests such as bugs, ants, and mice, if you want a social group, those types of things.
So it's an actual appointment, it's not like an online form.
Yeah, it's an
And
actual
last time,
appointment.
I really like that you're helping give the how to live healthy conversation.
Yeah.
They're not gonna listen.
To mom, yeah.
Necessarily.
Yeah, so that's why we teach those classes too.
I know, exactly.
That's why we had smoothies.
Exactly, because they were learning about making snacks.
But
That's what they did today.
We have some health education. We have them in booklets. They're pretty cool. I should have brought some, but they're just on topics like regular blood checks, blood pressure checks, vision checks, vaccines, dental checks, healthy relationships, cancer screenings, taking care of your body, those types of things. But they're all written in plain language, so they're in large print, so everybody can read them. Some different, what we like to say is that anything that may affect a person's physical, mental, emotional well-being is something that we can make a referral for. So we can do things like medical, dental, eye care, mental health, assistive technology or wellness classes, but also things like getting people connected to WIC, Housing Authority, social services, SSI, independent living services, and employment assistance. We can help as much as someone wants or as little as someone wants. We can make the appointment for them, or we can just give them the information. And then we have 2 different follow-ups. We have a 5 to 7 week follow-up. I forgot to mention, there's 3 steps to the project. At each step for completing it, our participants get a $25 gift card.
Cool.
Yep.
That's nice, that's good motivation.
Yeah. So we have a 5 to 7 week check-in after we provide the referrals, just to see if they need any assistance, if the referrals are going well, if they've been able to get connected to those resources. If not, we can address any barriers at this point. There's a second follow-up at 3 months. And at this point, we do a post-knowledge assessment. It has those same questions, like, can you tell me why it's important not to smoke? So we have those questions, and it's just to see if by setting goals and going to the doctor and getting connected to these types of things, if that helps you be more aware of your health. And that's it. Naomi's name's up there instead of Heather's, but it's cool. Thank you.
So are you connected at all to Voc Rehab then? Or is that
We just
another
work with them,
service? Okay.
yeah.
Okay.
They link people to us and we link people with them.
Yeah, we're referral sources for both ways.
And then for your programs,
We kind of do them we connect people as well,
right?
but like, we don't really do a lot of work with Voc Rehab anymore.
Oh, really?
We haven't been doing a lot of employment with them, but supporting employment does. That's up the street at Columbus.
What about once you're qualified for benefits and all of that, does that help you for your programs or no? So for Katie, I'd always pay no matter what I did. Okay.
Yeah, we're working on approaching it from a mental health angle instead of from a disability angle. Because all of our clients have some sort of mental illness.
Yes.
And we're hoping we can build Medicaid through
Yeah.
that angle. But because it's life skills, VR doesn't pay for it because it has to be work oriented. Yeah, so we're kind of in limbo right now, so it's expensive.
Yeah.
Which
but
bites.
you need- Yeah.
But-
you need to
But
to not make it up,
exactly,
so I
until we
totally
can
get it.
find a different funding source, we have to
Right.
be private pay. So we're always looking